All right, welcome back, viewers. As promised before the break, we of course have a significant discussion lined up about an ambitious project that has been launched. In fact, will be rolled out in the next few months. In a significant move now, which is of course aimed at enhancing road safety and providing immediate support to accident victims, Union Minister Nitin Gadkari has announced the nationwide rollout of the cashless treatment scheme set to be launched by, of course, March 2025. Now, this initiative that has already been tested on a pilot mode promises to cover medical expenses up to 1.5 lakh for all the victims of road accidents within the critical first 7 days following an accident. This, of course, will ensure that they receive timely care when it matters the most. However, as the government prepares to implement this particular ambitious program, which definitely does sound great on paper, there are several challenges that also lie ahead of them. From integrating complex IT systems and ensuring public awareness to preventing fraud and also ensuring efficient hospital coverage. Will this particular initiative truly become a boon for road accident victims in India, or will it face hurdles that could impede its effectiveness? On the show today, we'll explore both the promising potential of this scheme as well as the formidable obstacles that await this particular scheme. Joining us right now, I believe our guest for the show, Dr. Vipin Tyagi, who's a HOD and senior consultant, and of course from the orthopedic trauma of the Yashoda Hospital and Research Center, Nehru Nagar, Rajni Gandhi, General Secretary of the Tracks Road Safety NGO. And before we go to the guest today, let's also listen in to what the Union Road Minister, in fact, had to say about this particular scheme and also the plans that the Union government has.
जब एक्सीडेंट होता है तो हमने एक नई स्कीम शुरू की है, कैशलेस ट्रीटमेंट। और एक्सीडेंट होने के बाद तुरंत 24 घंटे के अंदर जैसे पुलिस में इंफॉर्मेशन जाएगी तो डॉक्टर जो होगा उसको, वो जो पेशेंट एडमिट होगा उसको 7 दिन तक ट्रीटमेंट का खर्चा या मैक्सिमम अप टू 1.5 लाख रुपए हम तुरंत देंगे उसकी ट्रीटमेंट के लिए। बाद में हीट एंड रन विक्टिम्स जो है उसमें भी मृत्यु होती है तो हम 2 लाख रुपए देंगे।
All right, so this in fact does sound like a very ambitious project, something that will really benefit road safety. It will enhance road safety initiatives and also benefit road accident victims. Rajni Gandhi ji, I'll start with you now. A very ambitious project on the outset. Of course, it's going to have a lot of challenges and we'll be discussing that throughout the show. But you've seen the details of this particular scheme that has been announced. Do you think it is going to be as effective as the government plans? What's your first assessment of it?
Frankly speaking, although on one side this is a welcome initiative, but secondly, we need to have a robust technical system to get it implemented in the right way. And secondly, as Mr. Gadkari well mentioned about that, it is a 1.7 lakh, 1.5 lakhs up to that amount. But in case of fatal injuries, if we consider, the amount goes in, multiple, 5 lakh, 10 lakh. The expenses are very high if we are going for it. So I think there is a need to have, it's a welcome move, but I think in case of road crashes, because it is increasing also every year, like, efforts are going in a different way. So this is a high time. I think the full treatment should be taken by the ministries and the central or the state governments, so that at least everybody should have that of sense that yes, the treatment could be free, whatever the amount it is. So I think that is the need of the hour. And secondly, we also have hit and run of, cases in that there are some support, financial support also for the victims. Still we are, facing some issues, technical issues are coming. So how that is going to be very smooth? Because on one hand, one victim or the victim families, sometimes, people are from poor families also, middle class also, whosoever is there. But the burden on that, the psychology is so different. Calling to this number, people are not even, they forget 112 even in that emergency situation. So that situation to be taken very, cautious way. And it should be very smoothen how it will work, the technical support, that if it is going for, the person is reaching to hospital, or somebody like a good Samaritan is taking that guy or that victim is to the hospital. So that should start in a very smoothen way. There should not be any, hassles to get that treatment in a free way. Yeah.
Right, right. Very interesting points that you mentioned here. One, the technical challenges that, of course, the government will face. And also, secondly, the public awareness as well has to be increased. Dr. Vipin Tyagi, now you've seen the details of this particular scheme and also some of the issues that Rajni ji here also pointed out. There are going to be a lot of challenges as far as the implementation is concerned. How exactly do you think this is going to work out? Because in a country where I saw a recent report which said that nearly 50% of the insurance claims are also partially or fully rejected. How exactly is the government going to ensure a seamless delivery of a service as complex as this in a country of the volume that India has? 1.8 lakh deaths every year due to road accidents. Lakhs of other people also have road accidents. So how do you see the government doing it?
First of all, thank you very much for engaging me in this, conversation. Uh, because I am the first person, being an orthopedic surgeon, trauma surgeon since 1982, I am in this field. So I am very happy that government has started something like this, because many patients, they don't get the facility in the first golden hour when the patients, usually the death and life and death situation. So many hospitals, small hospitals, first of all, I would like to say, tell the government also, and through your channel, that they should designate some hospitals which are able to take care of these patients. Because I face day in and day out this problem. Initially, patient goes to the small hospital, they waste their golden hour there, where they can be saved. But the facilities are not there because patient do not know, the ambulance person do not know. They take to the nearest hospital, whichever is there, but they do not have the facilities. So they should be taken to the hospital where the facilities are there. So these hospitals should be designated. They should be, numbers should be there with the ambulances. They can go there within an hour or less than an hour, because everywhere now the hospitals are there. This is the most important thing. And as Madam said, that 1.5 lakh is not enough money. I think it's more than enough money for initial treatment, where the patient's life and limb situation can be saved very much. Because I am directly dealing with this. I always, for so many years, I am dealing with trauma. My 75% cases are trauma. Polytrauma patients are in this hospital we are doing. Initially, there was not much hospitals around it in early 90s. We were the only hospital and doing lot of patients, this trauma patients there. So this is a very welcoming step by the government, where these patients can be taken care. So I'm very happy with this effort of but it should be implemented, and the hospitals should be instructed. Otherwise, there should be some legal action must be taken, because many hospitals, they refuse that you have to deposit the money. I know if my accidents happens,
Absolutely.
I don't carry credit card.
That's a major concern. That's a
Yeah,
major concern,
yeah.
doctor, because hospital rejections could also prove to be an obstacle for this particular scheme. Now, the government says that you can go to a hospital, will ensure coverage, but hospitals will be concerned about the reimbursements, the amount of time it will take, the amount of effort it will take to get reimbursement, because the mentality in this country is that sarkari kaam hai to bahut time lagega. So hospitals will now be of the mentality that if it's a government claim that has to come in, it will take a lot of time. So there is a chance that a lot of hospitals as well could reject all of these claims, reject all of these patients. At the end of the day, what it does is that it will make this entire scheme useless.
Yeah, but I'll tell you, I have full faith in Mr. Gadkari ji, because his all ministry, everything is doing so fine. And I don't think, I know so many contractors, those are road contractors, their money is never, no, for a single money, is they are not lapsed, or they are immediately releasing the money. So I don't think with this ministry there will be any problem with the money of the doctor. But hospital should be, being a doctor, I'll tell you, the hospital should be, legal action has to be taken. Those who are not taking care of such patients because nobody have money when the accident is there in the pocket to give the money. But treatment must be started. In our hospital, we have this policy. Blood, anything, we have to start the treatment. We have to save the life and limb. Then we talk about the money. Otherwise, we never. But not all the hospitals are doing like this.
Absolutely. Now, of course, doctor, you say that, your end, you're going to ensure that those people that need the treatment are taken care of. But Rajni ji, what this also brings about, you were talking about the technical challenges and also other obstacles that it might face. The problem in India is that a lot of schemes do not reach the people that actually deserve it because of a lot of fraud that happens in the interim. Do you think there's also a big concern of fraud claims as well that could seep into this entire system? Because we're looking at a lot of stakeholders being involved as well. Rajni ji, what are the sort of issues that we see, in fact, as far as this fraud settlements are also concerned? Because multiple stakeholders. The police has to be involved, the EDAR system, which is the E-detailed accident report, that also has to get in. Multiple government sites also have to be loaded at the right time to ensure that these claims are reimbursed. So there is a lot of chances of fraud as well in this particular scheme.
Hello. Hello.
Right, Rajni ji, this is a question for you. All right, we seem to have some issue there with